I'm talking to Dr. Naveen Samuel, who's a dentist in California. Dr. Samuel has run his own company, and that company is called Front Desk U, where he provides online training for front office dental staff. Dr. Samuel, how are you doing today?
Great, and thank you for having me on the call today, Matt. I really appreciate you inviting me to the program.
Awesome. Yeah, I'd just like to ask you a few questions about some of the maybe people transitioning out of the military or transitioning even from the jobs that they might be doing, as entry level or whatever, where they're trying to get into something new and a little bit more technical, possibly in the health field, maybe specifically dentistry, since you've been doing that for quite a long time. So again, thank you for your valuable time. Would you tell me a little bit more about your background?
Sure, absolutely, Matt. You know what, Matt, I have to let you know what you're doing here is great. I mean, providing valuable information to people who are looking to transition from a military career to the private sector, especially the healthcare field. That kind of information holds a lot of value. So, congratulations on choosing this topic for your message.
Oh, yeah, it's awesome. I appreciate your time, too.
Yeah, so just a little bit about my background. I've been practicing dentistry for 13 years, and I am in Sacramento, California right now, and state capital for California, and we have actually quite a bit of military that is around here as far as bases, Air Force bases, so it's nice to know that I've run into quite a few people in the military here, and it's nice to know that you're offering this kind of service, and whatever information I can offer people to help them transition into any kind of healthcare sector or in the private industry would be great. And then I started my company, Front Desk U, 3 years ago, and that was the main reason I started that was because I got approached by a lot of people during the recession years. I was just meeting people randomly. My goal out there was to market myself, market my practice, and get new patients. I mean, that's pretty much all what businesses do is they spend a lot of time wanting to get new customers. So as I was going out there marketing, getting to let people know, hey, I'm looking to, see if we can get some more patients for my practice, and I'd love for you to, come over and take a look at our office and see what you like. I would get approached by people constantly about, hey, I would love to join the dental field or, start working in the dental field because healthcare is just one of those industries that's very recession-proof. So it's always stays steady even through the bad years as far as the regular economy is concerned. So the nice thing about dentistry is it also is pretty steady as far as the ups and downs of the economy is concerned. Dentistry kind of stays put. It doesn't go up. It doesn't go down with the economy. People still need dental care, even through the bad years. So during this time, people would approach me and say, "Hey, I'd like to learn about working a dentist, in a dental office." And so I started, giving a few classes here and there and teaching people, saying, "Hey, just as long as I'm doing this, I'm training people. Why don't I start creating an online course?" And so that's what I did. Was I created an online course, and it's on my website, frontdesq.com. And basically, what it does is it just goes over different types of positions that you can work in a dental office. So there's the receptionist, obviously the person who answers the phone. There's a office manager. There's a dental treatment coordinator. There's the dental biller. So there's at least 4 or 5 different positions. Some offices are so busy they also have a scheduler, and that's for very high volume offices where the person's job is strictly to schedule dental patients to fill up the schedule for the doctors and hygienists that work in the office.
Yeah, that sounds interesting. Lots of people that work in there need the training, and it sounds like you've been able to provide a good, stable platform for people to get the consistent training they need.
Yeah, and just to clarify on training, as far as training requirements, in order for you to become a dentist, you have to have gone through 4 years of college. In the U.S., you got to go through 4 years of college as well as 4 years of dental school. And then, in order to be a dental specialist, like an orthodontist or oral surgeon or an endodontist, you would have to go through another 2 years of specialty training program. And that is very important for you to be considered a specialist. There's also a board approval process that you have to become board certified once you're a specialist too. So that's a very long, strenuous time frame. So it could take 8 to 10 years of your life. And as far as education concerns, for dental hygiene, it's not as bad. You go through 4 years of college and then 2 years of dental hygiene program. And some colleges have a combined 4-year degree where you do your first 2 years and your last 2 years, and you could graduate with a Bachelor of Science in dental hygiene. So that one's not as bad, and the income is very well too. It's very comparable to a nursing profession. So dental hygienists can keep a very good schedule as well as kind of maintain a lifestyle outside of work too. That and depending where you are, there's a very high demand for that. So you have the dentist that actually went to about 10 years of schooling, and then you have a dental hygienist who went through about 4 years of schooling, and then you have dental assistant. A lot of people think that you can just jump into dental assisting. You can just pick somebody off the street and jump it. That requires a little bit of technical knowledge as well as experience. So there's a lot of finesse and training that goes into dental assisting. And dental assisting schools are typically 9 months, about 700 hours, and about 160 hours of externship that needs to have to get 160 hours of on-the-job training, working in an office, volunteering, working in an office, and learning the profession before they can actually start working in it. And you can be a dental assistant, which is a non-certified position, or you can also become a certified dental assistant, and some states call it a registered dental assistant. And that also requires you to pass a board exam. So every one of these positions is a licensed position. The dentist is a licensed position. You have to pass a board, a dental board examination, and dental hygiene also. You have to pass a dental board examination by the state or by a regulatory organization, and also dental assisting. If you want to be a certified dental assistant or a registered dental assistant, you have to also pass a board test. So those are the three team members in a dental team. The fourth member, one of the most important positions in the dental office, would be basically the person answering the phones. The front office is the face of the practice. There's a lot of offices that do very well when they have highly trained and performing front office dental staff. And there's a lot of highly competent, highly skilled dentists that probably don't do as well as they should be doing. And part of that reasoning is because they may not have hired or properly trained their front office staff to receive and welcome their patients into the office. And those are the key things that we see when I look at a practice. When you call a practice, you don't get to speak to the dentist. You don't get to speak to the dental hygienist. You get to speak to the front office staff. They're the people that answer the phone. The receptionist answers the phone. Sometimes the office manager that answers the phone. So that first impression counts. That's what counts. You're not calling an office because you heard this wonderful dentist that everybody's talking raves about, and you have to go see this dentist because he's great, or she is great. The dentist is great. He or she, or the dental hygienist, he or she is just awesome, and you want to go meet this person, and you want to join their dental family. But when you call the office, you get somebody to answer the phone. Something happens. You don't click well with the person to answer the phone, and the appointment's never made. And that could be the make or break point as far as the success of a dental office.
Okay. Would that be kind of like the customer service representative at any other business? Somebody that is able to talk to a customer and either de-escalate sometimes or even help them navigate some questions that they have to calm their nerves, maybe about their dental experience or something that might be coming up, or even answer that question that could lead them to getting in there on a regular basis. Is that kind of the same thing as the customer service representative at another business?
Absolutely. I mean, that you hit it right on the nail. So that the customer service is the service part of the industry comes from the dentist and the dental staff serving their patients. And one service that's being performed is the service of answering the phone, answering a question, setting up the appointment, going over the treatment plan, the dental benefits of the patient. Those are very time-consuming events that the dentist by himself does not have time for. So the dentist is more interested in treating patients and doing the clinical portion, and the front office dental staff is more involved in facilitating the appointment, scheduling, billing, going over the treatment benefits, the dental benefits, the insurance benefits with the patient. So those are all the things that require a bit of experience and knowledge. And that's the one thing I love about doing what I do is I love to train people who have zero knowledge of probably never even set foot in the dental office before, and to take them from that level to feel comfortable enough that they can start answering patient questions and start representing a dental office. And So that's one thing I love to see that I'm able to accomplish with the students that I help train.
Yeah, that's awesome. I can hear the passion when you say it even. So that leads me to my next question, which since I'm working with people that are transitioning from the military or transitioning from job to job, maybe looking for something new, I always, get asked what qualities do employers look for? What kind of qualities would you look for in an individual that's seeking employment for you, or would you recommend that people have if they're seeking employment in the health industry, even as an entry level, like you say, maybe at the front desk, want to work their way up, in the health industry? What kind of qualities would you look for?
Yeah, I'm glad you brought up the phrase entry level. The entry level position in a dental office would more likely be in the back office, would be in working as a dental assistant, and just getting used to the surroundings of a dental office. So that getting used to the environment of a dental office can be a transition period. Now, for somebody who's been in the military for a very long time, the military, of course, they themselves provide their own dental care. They do have their own dental clinics. When I went to dental school, they had I had about 14 or 15 of my dental classmates decided to join the military during dental school, so the military was able to pay for most of their education, and that was a big. Obviously, they had to repay that in years of service. 4 years of dental school means 4 years of repayment to the military. And, I met several of those dentists later on, and they were transitioning to private practice, and they absolutely loved their experience working, everything that they learned from being in the military. Of course, the systems are very different in the military versus in the private sector. And but there's a lot of values that are being taught in the military that are great to bring on or transition on to the private sector. For instance, just being used to a regimen, being used to a very strong work ethic. There's a lot of dentists out there that are very precise in what they're expecting from their dental assistants or from the front office staff, and that's something military personnel already do. That's part of their training. And having said all that, there's still a lot of personality that goes along with the way you provide a service in the private industry. So that can be a transition period where you're learning to deal with the public now. So if you're dealing with the public, it's not as the same as dealing with all military personnel. If you're only seeing a homogeneous group of people that are, if you're working in a military base and you're only interacting with all military, it can be a hard transition to interact with the public and the outside population outside of a base or a military institution. So, so that transition can be hard. I can give you a specific example of somebody who actually used to work for me a long time ago when I had my office down south, and he was in the Marines for I want to say more than 10 years, and he decided to go back to school and get his dental assisting dental assisting certification, and he needed to find externships where he can work in the private office and finish up his hours. And I offered him the externship position in my office, and he, in the beginning, obviously, it was definitely a learning curve towards him learning about how to interact with dental patients who are not in the military. He would of course be very polite and very very genuine person, but very polite and genuine qualities, and he would always call everyone by ma'am and sir, and I would actually let him know. I said, that's really not necessary to call everyone ma'am and sir, and he would tell me that's part of the Southern hospitality. He grew up in the South, and and I said, patients like to be called by their name. I mean, just calling somebody by their name it's okay with them,
A little bit more personable.
Yeah, it's more personable, and a lot of it has to do with just interacting with patients and getting to know them on a personal level and understanding what their needs are. And then that's one perspective. The other perspective is actually understanding what the doctor's needs are, the dentist's needs are, as well as your coworkers, your dental staff, and the back office staff, which would be the dental assistants, and then the front office staff, which are the receptionists and the treatment coordinators. And when they're scheduling a patient, you have to be able to read a schedule, know which instruments to set up for the dentist. The dentist requires a certain procedure set up for different procedures, so you have to make sure that all those things are in place. So definitely attention to detail. I mean, having an attention to detail, treating everybody as with respect, and that's all those qualities are what you look for. Now, when I look at a resume, I would like to see, for back office, I would like to see at least a minimum of 2 years of experience. And that experience can be in any field. It could be in, you could be working as a medical assistant or a dental assistant, or you could be working as a front office dental staff, or you could have just volunteered in a dental office. But I want to look at, I need something like a base. If you had gone to a dental assisting school, a dental hygiene school, well, then obviously you have the education. But as far as an employer who is hiring, what they're trying to figure out is how much time am I investing into this person, as far as how much time am I going to invest into training this person. And during that training part, there is a cost for the employer. And the cost is a little bit of a downtime, because it takes time to explain to either an extern or a new employee as to how things are being done. So that there's a lot of trial and error, that's being taught here. And so the more experience you can have outside of that place that you want to interview for, the better off you will be, more prepared to work in a dental office. 2 hours is probably not going to cut it, but 2 weeks might be a little bit better. 2 months might be actually better, and then 2 years would be good, because you would actually do very well transitioning into an office. with having those 2 years of experience.
Okay. So one of the questions is sometimes, I don't have any, I've never had a job in a dental area, or I don't, maybe I want to transition, right? And like you said, somebody could volunteer. So what is one avenue that somebody could volunteer maybe in that type of environment to gain a little bit of experience? Because I'm all for the volunteer service as well. I mean, I think that's a great way to get that experience, and it answers the question that's always asked. They want experience, but how can I get experience if I can't get a job? And people seem to forget that there's that volunteer service that you can go there and maybe learn the business without even getting paid initially, because the pay could come later. So what do you suggest in this area?
So what I would suggest doing is volunteering. There's actually a lot of free healthcare clinics out there that also offer dental services. The dental services are not very common. It happens probably once every 3 months or so. And I would talk to whoever your local community services area is, and find out where the free dental clinics are. That would be a great place to get connected with possibly a potential employer right there. You would actually work side by side with somebody, and what you would do is you would just come in and shadow them. So you would work with a dental assistant who is already trained in the field, and you would come in and shadow with them, and then you get your hands wet a little bit. I mean, just not. Obviously, you have gloves on, so yeah. I meant figuratively that you're going to be getting your hands wet in the field. And so the goal here is that, of course, what you brought up is a very important point. How do you get experience if you have no experience? So the goal here is to gain experience, work side by side with people. Volunteering was a good way to do it. Going to dental schools and actually finding out if they have a dental assisting program there. The best possible route, I can tell you, is to go through the school, go get the training. It looks a lot better than on a resume if you're wanting to get hired than if you have zero experience and zero training. It's a lot harder to get trained, a lot harder to get hired. But a little bit of experience and no training will get you hired easier. A little bit of education or a little bit of training and no experience would also get you easier than with somebody with no experience and no training.
Okay. Yeah, sounds easy. That's so just people have to look outside the box kind of and think outside the box a little bit and think of ways that they can combine that education and training that maybe they haven't been able to receive before but want to change direction. So that makes total sense.
Right. And another thing to do is just, if you have no experience and no training at all, then definitely start putting a resume together and actually walk into dental offices and introduce yourself, dress well, obviously, look very professional, introduce yourself and tell them, hey, I'm new to the field and I'm willing to learn, and this is my background. Your background might be just working in fast food. But if your manager, if you're somebody who you work with, your coworker, give you a stellar review and says, I would hire this person just because of their strong work ethic and the fact that they're always willing to show up on time and do whatever you need to do to get the job done. Those are qualities that we're looking for. And so if you have people in the military who are already trained in those values or those qualities, then it makes it easier for you to transition into healthcare. And that could go for nursing, that could go for physical therapist assistants, it can go for working in the speech and language hearing divisions, respiratory care. It could work for hospital employee, pharmaceutical, anything you want to go into. There's always an entry level position which requires the minimal amount of education and experience to get in, and then once you get in, now you can start advancing in your career with more experience and more education.
Okay. Yeah, it makes sense. So people just have to be willing to put in that work and
and a lot of it has to do with just finding this networking and finding the right person who's willing to take that chance on you. I'm willing to take a chance on somebody who I know that I can trust is not going to do any damage to the practice. There's sometimes people that are very outgoing, and you look at them and they have this incredible personality, and then sometimes they say a little too much, and then you have to pull them back and say, hey, that might have been unnecessary, and an unnecessary topic, or we shouldn't be talking about things like that in a medical field or in the healthcare field. So those are, just because you have this great bubbly personality doesn't mean it's going to work out for you great. You also have to have some sort of tactfulness in the way you present yourself to create very healthy boundaries, so you're not stepping on people's toes or making the dentist look bad, or if you're a nurse and if you're a nursing student and you're there representing a hospital or organization, you got to make sure that you're not saying anything that could damage somebody's reputation or possibly their license too.
Okay.
Yeah.
That makes sense. Yeah, appreciate that. And I got one more question. It's a little bit off the topic that we've been talking about, but I'm just interested in books and reading and what people have read in their life. So my question is, what is one book that you have gifted most over your life, or one book that has influenced you most in your life?
Yeah, that's a very good question. Let me think about this one. I think I'll have to say John Maxwell's book on leadership. He's got several books on leadership, but I like the 21 Laws of Leadership. I know I've given that book out a couple of times, and there's also Leadership Gold, which is a follow-up to what he talks about in the 21 Steps of or 21 Laws of Leadership. And I really enjoy working with people who can also see the same levels of leadership that I do in different organizations. If they were working in, they could be working in fast food or in the hospital, or if they could be working in their church. Every one of these companies or organizations have a leadership structure, and John Maxwell talks about everything rises and falls with leadership. And so if you look at very successful companies and organizations out there, the leadership in that company is what brought them there. And if you look at unsuccessful, companies that have failed and gone out of business or had to close down, you can also look at the leadership there too, and and see some criteria that could have been improved on that wasn't addressed. And sometimes you could have the best employees. You can hire great employees, but if the leadership structure is not present, then you can lose great employees. And that's happened in my personal life too. I've worked for amazing companies before, but there were two members in the leadership structure that I didn't see eye to eye with. And instead of compromising, instead of finding middle ground, instead of finding a way that we can work together, it just didn't happen. And so, unfortunately, I wasn't able to stay with that company. But on the plus side, I've also been able to work with leaders who, when I walked into the company, they were not quite sure as to how to work with me. And we found common ground. We found ways of communicating with each other. We found ways to help each other out. And ultimately, our goal was to help the company grow. And as long as our values, our mission was the same, and our vision was the same, we could follow the same vision, then things would work out much better for the company and for the organization. So those are the two books I'd like to, I've gifted before, and I will also love is one is The Leadership Goal by John Maxwell, and the other one is The 21 Laws of Leadership by John Maxwell.
All right. Well, very good. Yeah, I'll list those in the show notes there, so people can check those out. And well, again, Dr. Samuel, appreciate your time this afternoon. I know it's very valuable. And so, how would you suggest that people that want to learn more about what you're doing with your company, Front Desk U, or if they have possibly some questions about getting into the dental field or medical field somehow, how would they get in touch with you?
So My website's frontdesku.com. You can always contact me through the website there directly, or you can contact me by my email. It's frontdesku@gmail.com. So it's going to be frontdesk, the letter U.com, or frontdesku@gmail.com. And both ways is you can contact me both ways. And I'd love to help out people, and if they're looking to transition from, if they may not be interested in dentistry, but they might be just wanting to go into healthcare, and that's fine too. They're more than welcome to contact me.
Okay. All right. Well, thank you very much, like I said, for your time. It's valuable, and I appreciate all the great information that you've provided here. I will put some show notes together so people can kind of catch up on and, see the basics of what we talked about there. And if you have any last-minute things you'd like to say or throw in there, any save rounds?
Well, yeah. First of all, Matt, I'd like to thank you for having me on the show, and thank you for the work that you're providing for your listeners. And and I wish you a lot of success. I know this will be successful. And thank you so much for having me on the show.
All right. Well, Dr. Samuel, I appreciate you and all that you do. Have a great afternoon. And there you have Dr. Samuel, a dentist, talking about how to transition into possibly the healthcare field, specifically dentistry. Thanks. Have a great day.